Well, good morning, everyone. Here today, joined by the Health Minister, Brad Hazzard, the Chief Health Officer, Dr. Kerry Chant, the Secretary of the Department of Education, Georgina Harrison, and the Chair of UNICEF Australia, Anne Sherry. Can I begin today by thanking our wonderful health workers right across the state who continue to work day in, day out to provide care, love and support for those people in our hospitals. Right across the board, our health teams, it's our doctors, our nurses, our paramedics, our 000 call operators and cleaners in the hospitals. Right across the board, they've done an amazing job over the last 2 years and as we've moved through this phase of the pandemic, and a complete inspiration to everybody. So on behalf of everybody across New South Wales, can I once again thank you for everything that you are doing to keep us safe during this period of time. As you'd be aware, yesterday we announced our back to school policy, and Anne Sherry will make some further comments in relation to the importance of education for our children and the importance of getting our children back into school day one, term one. We set out a plan, we've invested in it, we've resourced it, and we are ready to go to ensure that our schools are able to open in a safe way for our teachers and for our children. As a parent, I know that many parents across our state are anxious about the return to school, and also many teachers are as well. But we have put everything in place to ensure that we can have our schools open in a safe way. The massive operation which we set out to achieve in relation to the distribution and obviously the acquisition of rapid antigen tests has been incredibly successful. Already today we have 5 million rapid antigen tests that have been distributed to schools across our state, and the rest are following over the next day. Can I thank the volunteers in the Department of Education who came out outside their general ordinary course of work to ensure that we were able to receive those tests, package those tests and face masks and PPE, and have sent them out to schools right across New South Wales. It has been a significant achievement, a massive military operation. We've had over 3,000 schools across New South Wales who will be receiving these tests, over 5,000 early childhood centres across New South Wales as well. We've taken the responsibility in that space because we want to ensure that parents are able to have the confidence to send their kids to childcare and early childhood learning as the school term commences. This is incredibly important, and we believe that the plan we set out alongside the work with the Victorian government, who I want to thank as well, because the work that Georgina Harrison has done and with the Victorian Department of Education has ensured that 2 states in a very similar situation have not needed to delay the start of the school term. We've had many students across our state over the last 2 years of the pandemic, in certain cases have lost a quarter of their school or their face-to-face learning. So it's incredibly important that we have our kids back in the classroom. It is essential for their educational outcomes, for the opportunities in their life going forward. And it's been a key priority of the government. Now, I know that there will be difficulties and challenges as we move through, and that's only natural in the course of a pandemic. We had some challenges in Term 4 last year, where at various points in time, a small number of schools had to close. We do not want to see that this year. It will be an absolute last resort. We believe the measures we have in place will give confidence to parents and confidence to teachers that we can open our schools in a very safe way. I want to thank the 1,000 people who came forward, retired teachers as well as final year university students, to provide that buffer and provide assistance to our education system at this time. I think it speaks volumes of the values of our great state, that everybody is willing to work together to put their hands up to assist, and to have 1,000 people come forward to provide that support, that additional support for our education system. I think we're truly blessed, and I really want to thank those 1,000 people who have come forward, put their hands up, right up their sleeve and said, I want to be here to help, I want to get kids back in the classroom in a safe way. And can I thank the teachers as well, because I know not just parents but teachers are anxious as well, but we believe if you look at all the other all the other states and territories in the country, that the Victorian and New South Wales plans lead the way. And working together, we've been able to provide the resourcing and the investment in going out early and acquiring those rapid antigen tests should give confidence that we'll be able to have our kids back in the classrooms day one to term one in a very safe way. But I do accept that as we move through, there will be difficulties, there will be time off school, but in the main, we will have kids in the classroom in an incredibly safe way. I want to speak briefly in relation to booster shots as well. Boosters are incredibly key. We say this at every press conference. Now, as you'd be aware, we moved that date from 4 months to 3 months for booster shots to be provided in our vaccination centres, over 40 across New South Wales. We now have, and it's pleasing to see, 40%, close to 40% of the eligible population here in our state has received a booster shot. Boosters are key, but there is still capacity in our centres. We can administer up to 250,000 vaccinations per week in our centres. So I ask people, if you haven't made that appointment, you've come back from your summer break, please make that appointment either at your GP, your pharmacist, or at one of our centres. We've seen it very clearly that vaccinations have been the key right across our state in ensuring that symptoms are less severe. The efforts that everybody's made has ensured that that is the case, but we need to continue the push. We need to continue to get vaccinated, to get that booster shot. It's key to keeping yourself, your friends and your family safe, and I want to thank everybody for the effort that they have made. We don't know what's going to come in the future. This pandemic will continue to provide curveballs coming our way. But what we can do as a state, and what we have done over the last 2 years, is continue to make those efforts and sacrifices of getting vaccinated and getting boosted. That's the best protection as we move through. And I'm very proud to be the Premier of the state with such a high vaccination rate. And if you look globally, no one really competes with the efforts that we've made in our state. So can I thank everybody for the efforts they've made over the last 2 years, the efforts they've made over summer. If we can continue that final push, it will ensure that we continue to keep our community safe and ensure that we keep society open as we move through. And if we can continue to treat everyone with kindness and respect that we've shown everybody over the last 2 years, remember that we have a lot to be proud of here in our great state. The efforts that our people have made will ensure that we come out more unified and stronger on the other side. I'm now going to have Dr. Kerry Chant, Chief Health Officer, provide a public health update. Then Minister Hazzard will also echo those sentiments in relation to vaccination and booster shots across our state. Georgina Harrison will give an update in relation to our back-to-school plan, and then Anne Sherry will speak to the importance of getting our children back into the classroom for their educational outcomes.
It's pleasing to see that we have over 95% of people aged 16 plus have had 1 dose of vaccine and 93.9% aged 16 plus have had 2 doses of the vaccine. In the 12 to 15-year-old age group, we've got 82.7% have had their first dose and 78.4%. It's pleasing to see that has increased, but I would urge all parents to take their children to get vaccinated in that age group before school commences. In the 5 to 11-year-old age group, we've got 28% of children have had their first dose of COVID vaccine, and we're really hopeful that that will increase significantly this week ahead of school commencing. And almost 40% of the eligible population have received a booster. In terms of our hospitals, we've currently got 2,816 people in hospital, including 196 people in ICU, of whom 69 are ventilated. And we've had 15,091 positive test results returned, and that includes 6,901 rapid antigen tests and 8,190 positive PCR tests. The PCR tests, the 8,190 positive PCR tests, were returned from 48,481 PCR tests. Now, this is a lowercase number that has to be interpreted with a bit of caution. We do see those lower testing rates over the weekend. But it is pleasing that when we look at a range of measures, our assessment indicates that the spread of COVID virus is slowing. our situation is stabilising, and whilst we expect to see a little bit of an uptick in transmission associated with schools going back, I just want to say that this can be mitigated by the actions of you as individuals. Getting those boosters will help us. They'll also help us and have some effect on transmission by preventing you acquiring infection and passing it on. And then those simple actions that we're going to need to pursue right through this year is by staying home if you have symptoms, COVID symptoms. Get tested and stay at home. Continuing to wear those masks indoors and just being careful about the environments you choose to go to. So please get out and about, enjoy our not so good weather today, but our weather, and enjoy those wonderful outdoor spaces, and but do so in a safe way. So I'm really pleased to see that we've got a range of measures to support school children going back. But can I be clear? Whilst we've got the 40% of the eligible population vaccinated, the evidence is that you really do need a booster. So and all of those people that are sitting there with those 2 doses and think, I've done my bit, I've protected myself, we now know that, particularly for the Omicron variant, immunity wanes, you need that higher level of protection, and you need to get a booster dose. And we know that it's incredibly strong evidence that a booster dose significantly reduces your risk of hospitalisation and death. And can I just urge a sense of urgency in the community to come out and get that booster. We have got available appointments, and it is despairing when I read out the tragic death numbers, which I'm now going to do, that some people have missed that opportunity afforded by the booster. So sadly today, New South Wales is reporting 24 people who have died from COVID, 16 men and 8 women. And again, can I express my sincere condolences to their families. Of the 24 people who died, 2 people were in their 50s, 1 person was in their 60s, 2 people were in their 70s, 12 were in their 80s, and 7 people were in their 90s. And we know of the 2 people who died under 65, both were men who had serious underlying health conditions. 1 man had received 2 doses of the vaccine, and 1 had received 3 doses.
Good morning, all. I just want to raise the issue of the vaccinations also. We know we've been very lucky. I mean, this time last year we were only just starting to hear about vaccinations, but in the last 12 months, vaccinations have been front and centre in terms of the response to this COVID pandemic here in New South Wales, indeed across Australia. What is disturbing for me is that the good news is 95% of adults, so 16 plus, have had their first dose, and 93.9 have had their second dose. But those adults have children, and their children in the 12 to 15-year-old age group are sitting somewhere between 12 and 15% lower than the number of vaccinations that adults have had. So to the parents who've gone and got vaccinated, if you've got a teenager at home, a 12 to 15-year-old who hasn't been vaccinated, if they're sitting in that somewhere between 12 and 15%, depending on whether it's first dose or second dose, and not having had it, can I just say to those parents, we all have obligations as parents to make sure our kids are kept as safe as possible. We love our kids, we try to keep them safe. Obviously, this is one big area that, as a health minister, but also as a parent, I would say to all parents in New South Wales, take a close look at what your kid's vaccination status is. And if your teenagers, if your 12 to 15-year-olds haven't been out and got vaccinated yet, go and get them vaccinated. There's no question vaccinations are the simplest safety measure we have to minimise the transmission, but also to minimise the likelihood of any serious outcomes for each of us, particularly our children. Also, Dr. Chant has just told us that we had 24 people pass away in the last 24 hours. And first of all, I'd like to just obviously express my condolences to each and every one of the families and friends of those people who've passed away. And again, to remind everybody that there's families and friends behind every one of these numbers that we talk about here, but they're actually people. So my sincerest condolences to each of them, to each of the families and friends of those people. But I want to say this, out of the 24 people, there are only two. There are only two that have had 3 shots. In other words, only 2 people out of 24 had the booster shot. That's a very clear message to all of us that we need to listen to the advice of the Premier and Dr. Chant. Boosters are absolutely critical to keeping us safe. The 2 people who did have the boosters in this particular case will form part of the group that Dr. Chant will later in the week give more information on. But I will say at this point they clearly had, sadly, they had some very serious pre-existing medical conditions. So boosters are critical. Boosters are what makes the difference for adults. So go and get boosted if you haven't had it. And I know I've got friends who have talked about the fact that, oh, do we really need to go and get it? Well, yes, you do. Because if you don't go and get the booster, you're one of the people who might end up, unfortunately, being very, very sick in our hospital, being in ICUs, putting our health staff at risk, but also putting your own lives at risk. Go and get boosted.
Good morning. Can I reiterate to every parent across the state, get your child vaccinated. If they've had 1 dose, go back for the second, and if you haven't booked in for a dose yet, please do so. Can I also remind our teachers that the vast majority of you are now eligible for a vaccine booster. Please go and get that vaccine booster as the first available opportunity. Parents across the state can be assured that we are ready for term 1. As the Premier indicated, we have 5 million rapid antigen tests out on the road by today, and another 1 million expected to be out on the road by the end of today. They will be arriving at schools over the coming days. And can I ask parents to be patient with your school? They will be in touch with you about when you can come and pick up your tests once they have received them and mapped out their approach to handing those out to the community. They will be in touch with you. Please be patient and we'll make sure those rapid antigen tests get to you and your families. As we prepare to manage the current wave of COVID in our schools, many of our families will have experienced COVID in their own homes or in their broader social networks through these holidays. We know there is COVID in the community, so we know there will be COVID in our schools and in our school community. But what we have is a series of layered measures to minimise the transmission of COVID through our classrooms and through our school communities. They are the best measures we could have in place. We have taken the expert health advice on each and every one of them. Where there is a positive case in a school, your principal will let you know that there has been confirmed cases in the school community and identify the relevant cohorts and year groups that have been impacted. But we remind all parents the thing you need to do is monitor for symptoms. If your child has symptoms, don't send them to school. If you take your rapid antigen tests and you get a positive test, stay home and make sure that you follow the health advice. And so we're putting those measures in place to keep everybody safe in our schools. Across the last 2 years, we've moved in school settings from a statewide response where we had everyone learning from home for a period of time in 2020 to a regional response in 2021 where we saw some areas experiencing longer periods of learning from home than others. And in 2022, we're moving to a very localised response. And so that means we're asking all parents to listen to the advice from your school. As a last resort, if we need to move to learning from home, we will do it for as few students as possible, for as short a time as possible. And we ask all parents to follow the advice of your school if that occurs in your community. I also want to thank our teachers this morning. Everyone assumes that schools are quiet and shut for the whole of the school holidays. What we know in education is actually our teachers, especially at this last end of the holidays, are working exceptionally hard to prepare for the year ahead. Thank you for all that you are doing, because we know through the years that we've just experienced that we need to have agile plans in place and be ready to respond accordingly. I want to thank you and all of our school workforce for their resilience and adaptability over the last 2 years. I know that our teachers will be ready for day one. I know they will have the plans in place so that if they need to hand over a class to a colleague, they can pick that up and maintain that continuity of learning for our students. If a student does need to learn at home for a period of time because they're isolating as a household contact, we have got an exceptionally detailed set of support on our website for the Department of Education. year by year, stage by stage, subject by subject, lesson plans and support materials available for every student and to support those families. And finally, can I just send a message to our students? I spent a highlight of last week with a group of students talking about how important it was for them to get back to school. They told us how much they had missed and craved the structure, routine and purpose that school gives them, how much they have missed the relationships with their teachers, with their friends. And so please, students, focus on getting back to school, focus on seeing your friends and enjoying yourselves. Let us as the adults who are worrying about this, getting the plans in place, we have that sorted so that you can focus on getting back into school and carrying on learning. Thank you.
Morning everyone. I'm Anne Sherry, I'm the Chair of UNICEF Australia and I'm here really to bring the voice of children to the conversation as well and the research that we've been doing, and I support what Georgina Harrison has just said. What we know and what we're very strong on is that it's time for kids to get back to school. All the research says they need the school environment, they need to get back to learning, they need the social structure of school and their friends, and they know that they have to do that in a safe way. So they're not unaware, as all of you with kids would know, of what's going on around them, but they think that they can manage it themselves in their own environments as well, with support obviously from the education system and the health system. All of our research is saying that there's a group of kids who've done really well, and we saw the amazing Year 12s who seemed to blossom despite all the hardship, and congratulations to them, what an amazing group they were. But we also know there is a very large group of kids who are starting to fall behind, for whom internet is not that secure, for whom additional technology has not been that easy, for whom family structures and situations make learning hard for them. And that group of kids are really craving getting back into an environment where they can both learn, but also where they can catch up. Because we do have quite a big cohort over the last couple of years who haven't been able to keep pace with what they would normally have done at school. And hence our strong support for getting the school system working again, for doing everything we can from both a health and education point of view to make that happen, and to have those kids have connection and contact back with the education system. It's going to be important for New South Wales in the long term as well to have that cohort not fall behind, but to have them be able to catch up and be as effective as they can and achieve their own ambitions and dreams. So I'm really here today to say there's strong support for it, there's strong support globally for it as well, and there's very strong support here in New South Wales and Victoria.
Mr. Hazard. You want to wait till the chopper finishes, or is it? Well, let's have a go. You tell me if it suddenly is not appropriate for transmission, that the helicopter is about to take off.
Since the plan was officially released on Sunday,
Sorry.
Since the plan was released on Sunday,
The education plan, yep.
we've already had a lot of parents coming out saying they don't want to test their kids twice a week, which is going to be distressing to them, and saying that they're not going forward. What do you say to those parents who are not wanting to test their kids?
Look, what I would say is, I think as a parent, we all know and have had those moments. Doesn't matter what it is, we worry about our children, and we worry about. I can remember worrying about various issues when the kids were little, and I understand that. But what I would say is, just quietly and calmly talk to them and make sure they understand that this is a very simple process. It's not going to have any negative effect on them, and I'm sure the kids will actually, as long as there's a calm message to the children about the importance of staying safe and enjoying school, I'm absolutely certain the children will learn very quickly to accommodate for having the rapid antigen tests.
With parents saying, some saying that they're not going to be testing their kids, that does bring back the level of confidence, though, doesn't it? That this system is
Yeah, look, let's not. Almost 2 years to the day. Do you want to wait for this or not? We do want to wait. Well, sorry folks, we've got a helicopter taking off for someone who obviously needs some immediate help. So if you're watching somewhere else rather than here, we might just wait for a couple of minutes for the aircraft to take off. saying, I think that children will learn very quickly. It's a bit like when your kids are going to school, you teach them the basics of hand washing and what to do at school. I'll ask the Secretary of Education to make a couple of comments, although the Premier just did say through that helicopter noise that he's going to make it a fun exercise, teaching his kids about how to use rats at home. So good luck to the Premier and his 6.5 children. Can I ask?
Thank you, Minister. Our parents across New South Wales have been an incredible partner for education throughout this pandemic. When we asked parents to keep their children at home, when we needed to reduce movement through the community, they did just that. And we are really confident that our parents want to support our schools to stay open. And so I am confident that the vast majority of parents will follow the instructions from their school, that they will use those rapid antigen tests twice a week. No parent wants to send their child to school if they are sick. And no parent wants other children in their class to be there if they're sick. And that is the strength of community we will see throughout our schools as our parents continue to support us to keep those schools open.
Do you have any tips though, Georgina, on how to talk to children, especially little ones or those with special needs that might be really difficult to get a rat test out of them and an accurate one? How should parents be pitching this to their children?
Yeah, so as a mother of a 6-year-old, I have got to get a 6-year-old used to being tested every 2 days for school. There are some great materials online, and we'll be making those available through our schools. Our children understand and trust our adults, and they'll trust their parents that something is necessary. I'm certainly talking to my daughter that this is the thing we're doing to make sure you're okay and that all your friends are going to be okay, and all your friends are doing this too before they come into school, and it's the thing we're doing together as a community to keep everybody safe.
I mean, last week you said that the school's plan was going to be vastly different to last year because of the Omicron variant. Now, what we saw yesterday is a very similar plan, aside from the rapid antigen testing. We've actually seen some rules relaxed, like overnight camps and contact tracing. So can you explain how this plan is different and responding to the Omicron variant?
Well, probably the most significant change outside of rapid antigen tests is that where there is a positive case, we will not be tracking and tracing. And we've come a long way over the course of the last 2 years, but particularly in relation to having a high vaccination rate in our state, that we will deal through the rapid antigen tests that we will be applying with every school across the state, that if there is a positive case or a child or a teacher is a household contact, they will isolate. What we saw last time and last year was that there was a case in the main. We had many schools close. I shouldn't say many. There were some schools that closed. The overwhelming number of schools remained open last year, but there was inconvenience from time to time as we closed schools if there were cases, and there was obviously a significant amount of cleaning that we're in a very different phase of the pandemic today. We believe the use of rapid antigen tests for a 4-week period should ensure that we can open up our schools in a safe way, but also what's a crucial element here is instilling confidence in our teachers and in our parents that schools are a safe environment. And that will create inconvenience because that is substantially different. Yeah, sure, issues like cohorting and music lessons and camps and things like that will continue in a COVID-safe way. But the main change is in relation to tracking and tracing as we move through this next phase of the pandemic. But this is all about instilling confidence in our parents, in our children. I know many are anxious, but we believe the plan that we have in place alongside the Victorian government is one that works, one that is ready. We've invested significantly in it, and we're in a position, unlike other jurisdictions around the country, that can actually apply these rapid antigen tests because we went out early and resourced them.
I think a lot of parents will be concerned, though, that they won't know exactly what their exposure of their child has been in terms of contact tracing. They won't know if their child sat next to a positive child for the whole day. So what do you say to that?
Well, I accept that's different. But this is the right approach for the circumstances that we are in today. We know in the main that Omicron is less severe. We've seen that. Whilst more transmissible, it's less severe. We have a highly vaccinated population. And yes, as a parent as well, I know that many parents across the state are anxious about sending kids back to school. Many teachers are anxious. I was speaking to a teacher on the weekend who is anxious at the return to school. That's understandable in a pandemic, but it's really, really important for our kids' educational, social and mental health outcomes that they're back in the classroom. I accept that it won't be perfect. I accept that there will be issues as we move through this, but this is the right approach. And I'm very confident that by setting out this path, as we move through this next 4 weeks, and it's pleasing to see the case numbers coming down, and as Dr. Chan has said, we would expect as we move through return to school, case numbers will increase, and that's also associated with mobility and people going back to work, and that's why we've obviously got our plans in relation to childcare and early childhood education, that we're in a very strong position here in our state to open our schools safely. And I think the plan that we've worked on over the last 3 weeks will achieve that. It's been, whether it's the health teams, the education teams, we've worked day and night on this, and now we've resourced it, we've invested in it, and we're ready to go to open schools in a very safe way.
Premier, if we go through Commonwealth's aged care data, there's evidence to suggest that of all the deaths that have happened in the past week, a third of them have occurred in aged care. Can you confirm whether that is the case, and if so, does that concern you?
Okay.
I haven't got that data to hand, but obviously we do track that. So on my Friday update, we'll cover whether the deaths were in aged care or hospital or at home. I think that this highlights again the importance of boosters. So for any children or guardians of people in aged care, we know that the Commonwealth is rolling out the booster program in the aged care facilities. We appreciate their efforts, but we do need to get those boosters. And so if you're asked about, please be supportive of your loved one to get that booster. That third dose does protect you, but I've also indicated that, even a third dose in very frail elderly, it will still be a risk, so we will need to protect people going forward for those simple measures like mask wearing and other controls in those environments.
Would you consider formally changing the definition of fully vaccinated to take that into consideration given the proportion of the population is now eligible?
So this matter is being looked at by the target, and we will take our guidance from that. But I mean, my clear view is that boosters are essential. I've been boosted, my loved ones have been boosted, one's still got to be booked in, but the rest of them, when he becomes eligible. But I really can't stress enough that boosters now need to almost be seen not as boosters, but as almost a requirement to get the protection you need. Going forward, we may need to roll out other vaccines, and whether that's targeted at particular at-risk and vulnerable groups. But people should see that third dose as essential, noting that for those that are immunocompromised or have those other underlying diseases, you might actually need 4 doses to actually see your course complete.
Can I just ask 2 quick questions? First of all, your counterpart in federal, Greg Holmes, has called it, said it's official. He says the East Coast has peaked Omicron virus. The East Coast what? East Coast Omicron has peaked. We are on the way down. Do you agree with that? It's too early to call. Look, I think that the advice we're getting at the moment is it certainly appears to have plateaued or peaked, but I would also say that the one thing I've learned as health minister in the last 2 years in the middle of a pandemic is never say never, and never say anything with absolute certainty. So I think what we're facing here at the moment is clear learnings that we're going to live with this virus for quite a while in one form or another. We all need to have the vaccines, all the vaccines that are available to us, including the boosters. And as we move through, we have to expect that even though there's a lot of lightness and brightness about where we are at the moment, I think in a sense, yes, it's very sad that we're having people who are passing away, and obviously they've contracted the virus now a few weeks ago usually, but it is looking better. But we have to expect that as we move into what might be called the endemic phase, we're going to have issues from time to time, and we just have to do what we do with life, and that is get on with it, but also take the necessary safety measures. And the safety measures are essentially get boosted, and for our kids, get them vaccinated to the absolute allowable amount recommended by the TGA and the TARGI.
And then for you and Dr. Chan the last week or so, maybe a lot of given us a lot of detail about how the hospital numbers might actually be a little bit skewed by admissions on other reasons as well as COVID or patient.
Yeah, we've talked about that a few times. Yeah.
So the numbers might be artificially high. Can I therefore ask by extension, would the death toll also be potentially skewed by that same problem?
Yes. I mean, look, and that's why Dr. Chant is trying to give a weekly report. She'll do it, I think she announced that a few days ago, last week sometime, that she'll report that on Fridays to the extent that she can, within the reasonable privacy constraints and perhaps other coronial requirements. But there's no question that some of the people who we are reporting as having passed away with COVID, the question remains, is it from COVID or with COVID? And in some cases, it may be that COVID, like any other virus, has exacerbated their pre-existing medical condition. There may be others, for example, who chose not to be vaccinated. There may be others who have instructions in place not to be resuscitated. So there's a whole lot of factors that come into this.
Dr. Chant, you said that cases are expected to increase when schools return. What kind of increase are we looking at if they are going to increase when schools return? How can they affect?
So what we're saying is that we know from the outset, we've talked about increasing movement and increased interactions of social networks, increasing transmission. So as we bring people together and we get movement, we're going to see that increase in cases. But the counterbalance is we're also boosting. So boosting, if you, 7 days after you're boosted, 7 to 14 days, that will actually have a protective effect and drive case numbers down. Also, everyone's individual actions. So I'm sure that parents will be particularly careful when they're walking around on school grounds, the kindergarten parents that are taking their new ones to school. I'm sure that those COVID-safe measures on schools will really reduce any opportunities there for transmission in those settings. But also, if everyone's just minded to those safe things I said, don't go out and about when you've got illnesses. You know, if you've got COVID symptoms, please stay home, and that's going to be a message we give out going forward, and it's probably what we should have been doing around viral illnesses forever. But this has really been an opportunity that some of the things and behaviours that we've put in place for COVID actually are probably things we need to cement for the future. And I think that's probably the discussion we'll have going through 2022 is what are the things that we've put in place for COVID response that we really want to retain, because they've really helped us. I mean, our deaths associated with pneumonias, other respiratory viruses, other gastroviruses have really decreased, let me be clear, decreased, due to those very simple measures. I mean, hygiene works, you know, covering your mouth, wearing a mask when you've got an infection, staying at home, hand washing. Those simple things are really key to keeping numbers low.
Dr. Chant, do you have any thoughts on mental health though? Because I feel like everyone in the state, probably a lot of Australia, is kind of just in a bad place at the moment. Like, what are we going to do to, in the long term, just feel better about
I think we need to have a sense of optimism. I'm incredibly optimistic that we have such amazing vaccines. We have antiviral drugs coming. We have good access, increasing access to rapid antigen testing and good testing infrastructure for those that need it. We have a great healthcare system. I think that we should actually be optimistic. Obviously, Omicron has been had an impact because of the sheer numbers of the disease, and it has been, you know, severe for some, mild for most. But we are going to need to live with this virus. It is not going to be disappear. And what we'll need to do is just calibrate our response. But we know what works to stop transmission, and I just want to acknowledge the contribution the community's made to really seeing those declines or stabilisations. I'm always loath to call the decline. One few days doesn't make a trend, but it is really pleasing when we look across our absenteeism data, our hospitalisation data, our case data. But it's not a time for complacency either, but people should be confident to move about. And we've also told people about the measures that they need to do individually. So I would like to see people out and about enjoying the weather. At least it's not a heat wave, so the weather we've got today. And please feel confident armed with the tools, knowing that people are wearing masks, knowing that people are really respectful of social distancing and some of those other safety measures.
Dr. Chan, just very last question, school drop-off and pick-up, any rules on that?
Look, the schools will put up their own rules. I know that there's components of staggered starts, and probably George is best to answer that one.
So many parents would have seen last year that we had staggered start and finish times for some cohorts, schools staggered break times so that cohorts within a school could be kept separate. We will be starting the year that way for the first 4 weeks. I think it's really important that we're monitoring how these settings work and that we'll review them through that period to make sure we make any adjustments that we're able to as we head into the second half of term.
In a perfect world, every parent would be doing that test twice a week, but we've heard that some parents are not willing to do that, or maybe if their children are asymptomatic, they might not see the need to do it. I'm speaking with a parent right now who said because of this and it not being mandatory, it's a recommendation. She's not sending her children back to school. They're immunocompromised, she's immunocompromised. She says at this stage, at least for the first month of term, she won't be sending them. Will there be another cohort of children who will be now learning from home and be disadvantaged because they can't be certain that schools are safe?
So firstly, for the vast majority of our students, school is the best place for them to be. We're confident our parents will use those rapid antigen tests, that they want to help keep our school communities safe. I can understand that if there is a parent who has a child who is immunocompromised and they're worried about their health, they will feel more anxious about that than others. Our schools already support those students every day. They know those students, and so please talk to your school and make sure the right arrangements are in place for them. We have been doing that all through this pandemic, and we'll continue to do it through 2022.
Premier, then can we have an update on your plans to subsidise free wraps through a Dine and Discover style voucher that was mentioned earlier this month? And on a separate note, just following on from that earlier question, are you optimistic we've peaked here in New South Wales or are nearing the peak?
Well, I'll answer the second one first. As the Health Minister has said, and Dr. Chan, it's early days. It's very difficult to actually tell. There are pleasing signs. We're not less focused, we've always said, on the case numbers. We're more focused on our hospitalisations, our ICU and the death numbers. And when you look at every Friday, when we release how we're tracking in relation to ICUs and hospitalisations, I think that's very reassuring and encouraging in terms of seeing the signs. We invested heavily in our health system over the last 10 years, and particularly at the outset of the pandemic. And as the former Treasurer with the Health Minister, 2 years ago, when this pandemic began, I said to the Health Minister, whatever investment you need to build up capacity in our health system, you will have. And we invested $4 billion in our health system over that period of time to increase capacity in our hospitals. And so to see, as we have over the last 2 weeks, that we are tracking better than our best case scenario, I think is incredibly pleasing. But there's a long way to go, and you don't know what curveballs are going to come through the pandemic. There will always be issues coming our way. But I think if you look at those hospitalisations and ICU numbers, the key factor in that has been vaccination. And we had more people in ICU at the peak during Delta than we have now. And that was because it was at that time where the vaccination rates weren't high. Obviously Delta was more severe, but the efforts that everybody's made across our state has ensured that our health system has had the capacity to deal with the challenge. But there will be more challenges that come. We don't know whether there'll be further waves, but what we have to do is prepare. That's exactly what we've done. We've done that at the outset of the pandemic, and that's why you're seeing other jurisdictions who haven't invested heavily in their health system do not have the capacity. They need to rely on hotels, need to keep their borders closed because their health system is not as prepared as ours in New South Wales. So we should be very assured that whilst there are challenges and the health system is under pressure, being in a pandemic, and our nurses and frontline health workers are working day and night to keep people safe, the capacity in our health system here in New South Wales is incredibly strong. And in relation to Dine and Discover, the Customer Service Minister is working on that. We haven't committed to that. What we said was we will certainly look at it, and if there was a need there where we could provide additional support, we would. Our focus has been at the moment, whilst that work is the Customer Service Minister and Service New South Wales are working through that. What we're focused on is ensuring that we're able to, firstly, purchase a significant amount of rapid antigen tests, which we have done, 150 million of them, and that we use those tests to support those areas in New South Wales which the government has particular responsibility for. There's a reason why only Victoria and New South Wales are the states that are implementing rapid antigen tests, because we went out and purchased them. And so to the question earlier in relation to the comfort for parents of having those rapid antigen tests, parents across our state should be very reassured that New South Wales and Victoria have put our schools in the best position possible so that they can open safely on day one. We're also using our tests to support other areas, and if there's a need, for example, where we can support the federal government with aged care, we will. But also in terms of transport, in terms of our health workers, in terms of supporting social housing, we are working through those issues to make sure we're able to provide those tests for those who need it, and particularly vulnerable people right across our state.
Western Australia government has said that they're giving up on eliminating the virus and they're suppressing it instead. Do you have any message of support to the government of the WA having gone through this?
I mean, it's not for me to comment on the positions, because every state finds themselves in a different position. But ultimately, you can't hide from the virus. There is no jurisdiction. I think there's probably China and Hong Kong are the only jurisdictions in the world that are going down an elimination path. It's very clear you can't eliminate the virus. What we have to do as a state, and what we've done in New South Wales, is face into it. Put rules in place. But ultimately, getting vaccinated, getting boosted, has kept us safe and put downward pressure on the health system while having our society open alongside it. And that's been the move. If you look through the last 2 years, this is where the change is. And the transition can be hard. The transition can be daunting and create anxiety. But we're in a very different position here in New South Wales and around the country than we were last year, where we had a more deadly variant and a highly unvaccinated population. We now have a highly vaccinated population, a less severe variant, and that means we can open up. That means we can have society move. That will take time for confidence to come back. And if another wave comes, there's no doubt that confidence may take a hit again.
Do you think our border should be open?
The WA border?
Yes.
Well, I mean, no, it's not for me to make comment on other premiers' domestic policy, but I do believe we are one country. I do believe that we should move together, and I know that when the announcement was made, from a New South Wales perspective, there are many families in our state who have not seen their families in Western Australia for years, and many tears were shed on that day. It was very, for many families across New South Wales, gutting when that decision was made. But ultimately, they are that. Western Australia knows their health system and their issues better than any of us do, and I think the issues of the past in terms of division. And I know I know there's natural interest in different views that different governments take, and a focus on division. But from my perspective, we're focused on unity. And I think if you look at the schools plan, that's occurred, and this has not received enough attention in the pandemic. The constant collaboration between governments has helped put Australia in a very good position in this pandemic.
Just on that though, on the WA question, the WA Health Minister's come out and taken a swipe at us saying that we've been living in lockdown conditions and they won't open up because they don't want to be like New South Wales. What do you think of that?
Well, look at New South Wales is open. There is no doubt. Go out on the weekend. The shops are open. The pubs are open. The restaurants, the bars. Now, activity is lower than it has been in the past, and that's only natural when cases increase. But Chris, you can't hide from the virus. You can't eliminate the virus. We've seen that around the world. What you can do is get vaccinated. I know when case numbers increase, confidence declines. When case numbers decrease, confidence increases off the back of it. And that means people go out and spend. We're seeing so many reports in terms of household savings, in terms of we move through this next phase of the virus, that confidence will come back. And confidence is key. It's been key over the last 2 years. And as we move through, I know our economic rebound will be just the same as it has been in the past. We've kept people in work. We've kept businesses open. That's been the success in New South Wales. And to be frank, that's been the country's success. And I know we can be negative, but if you look around Australia and then compare Australia's response to the rest of the world, when it comes to hospitalisations, ICUs and death rates, and at the same time our economic response as well, keeping people in work, keeping businesses open, we have been incredibly successful. So I would disagree. I would disagree with those comments, but ultimately, we want Western Australia to come through this. We want the entire country to come through this, and I have complete confidence we will.
When is that business support happening? So the indications from last week, is the federal government delaying it?
The federal government?
Yeah, your talks about JobSave or particular packages.
Well, I know the Treasurer. I mean, the advice I'm giving the Treasurer, I know he's working on it, is take your time to get it right. And that's what I learned through press conference after press conference over the last 2 years. Whenever there's a discussion around getting money out the door, the best thing to do is make sure that where you invest with impact, and you tailor your support. And it's been politicised over the last 2 years. Every time we've gone through a difficult patch in relation to the virus, there has been politics played in a pandemic, which is pretty poor. What we should be saying is the government will ensure, as we have over the last 2 years, keeping businesses open and keeping people in work. The situation we're in today is very different to the last 2 years. To the question that Chris raised, we were in a position over the last 2 years in those outbreaks where, when we were in lockdown, every business was closed. That's not the case today. Having said that, there are certain areas that have done it tough over this period of time. The Treasurer is working very closely with stakeholders and industry groups, just as we've done over the last 2 years, to make sure that where we invest, it has the impact that's needed, and that is keeping businesses going and keeping people in work. That's been our focus over the last 2 years, and that will be our focus now. I don't mind if I have to rock up at every press conference to get asked the same question, because I know what we've done over the last 2 years worked. It worked. It kept people in jobs, and that's proven by the facts. Okay, look at the unemployment rate at 4% coming into Omicron. That didn't just happen. That happened because we provided financial support to keep businesses going, to keep people in work. That has been our success in our state over the last 2 years, and the approach we've taken in the past is exactly the same approach that we will take going through.
Just on news today, it's been revealed Prime Minister Scott Morrison's WeChat account has been taken over and rebranded as a pro-government platform. Are you concerned by that?
I didn't even know what WeChat was until recently. So, look, see, people have to be careful on all forms of apps that they use. But I'm not. I saw the article briefly this morning, but I'm not really across the detail. But ultimately, I think in a world of modern technology, whether it's governments or whether it's people right across the state in the country, they should always be careful when using those platforms.
Who do you think is politicizing?
Last one.
You mentioned some people politicizing the pandemic in relation to the business, businesses struggling in the grants. Who did you mean?
Well, the opposition have played the same game over the last 2 years and continue to do it, saying, "Where's the funding? Where's the funding?" The best thing to do is to hold, to assess, to consult, and that's exactly what the Treasurer is doing, and that's exactly what we did. It's exactly what we did over the last 2 years. My message to business is that we've had your back over the last 2 years, and we'll continue to have your back as we move through. And that's borne out in the fact of the support that businesses have had. New South Wales has provided more financial support for businesses and for families across our state than any other jurisdiction, and it's not even close. So we've done that every single time, and the best indicator of future performance is past performance. That's borne out in the substantial financial support that we provided. That's borne out in the business numbers. That's borne out in the unemployment rate, in the jobs growth, after the jobs that we lost in the outset of the Alpha pandemic, we recovered every single one of them, plus 30,000 more. That success has been because we took time, we invested where it was needed, and we got businesses through. And that's the approach. We've said from the outset, as a former treasurer, and even the discussions I've had with the current treasurer in relation to this, is that we will always put our people and businesses before the budget. And that's what we've done every time. And we've been able to do that in New South Wales because of our strong financial management over the last 10 years. The economic position that our state is in going into the pandemic. The opposition opposed all of the means in which we had the budget in a very strong position, and we were able to deploy our financial strength to help keep businesses through. Now, it's not my money, it's your money, the taxpayers of New South Wales. Our job is to make sure we invest for impact, we invest to keep people in work, we invest to keep businesses open. We've done that over the last 2 years, and we'll continue to do it as we move through the next phase. Thanks.
Thanks, everybody. Thank you. Thank you very much. Thank you. Thanks very much. Thank you.